If you were to put one descriptor for the transplant activity here at VCU, clinical excellence stands out without question. There's a dedicated team of professionals who are passionate about the mission, passionate about patient care. And if you look at the major metrics in transplantation as it's performed here at VCU, namely patient survival, graft survival, Hume really stands out. Hume Transplant Center is a very special place in the world of transplantation. Back in 1956, which was a long time ago, Hume and people of his generation really were true pioneers and sort of conceptualized being able to take one organ from one person to the other and have it work and have it be a treatment for organ failure. So he came to MCV and founded a transplant program, founded a transplant unit, which was the first of its kind in the country, and really established some firsts here for Virginia and really for the Mid-Atlantic: kidney transplantation, ultimately liver transplantation. So that's the Hume and Hume Lee. Hume died much too young, died in a plane crash actually. His void, which was a tremendous void, was picked up by H.M. Lee, who was one of his understudies, an accomplished vascular surgeon who was passionate about patient care. And so when it came time to try to understand the legacy of this transplant program that's been around now for 50 years, it became, I think, a no-brainer really to name it after these two pioneers. The aspiration for all of us who work in this field are to not necessarily turn back the clock, but try to minimize the ravages of disease that led to the need for transplantation, if you will, to restore life to as normal as possible, however you define normal. It often goes back to better than normal in that patients have an understanding of how ill they had been, and so perhaps incredibly appreciative of how well they are now. They understand that their life expectancy is so much better than when they fell ill, and because of the organ transplant, they have to make some adjustments to their lives.
Once I got the kidney, I was like, oh, I didn't realize how much I was feeling bad, but now I feel good. Just starting to enjoy life again.
So it's frequent in transplantation to have patient reunions. So on a yearly basis, patients and their families get together, whether you call it a patient reunion or a picnic or whatever else. And so I go to these because it's always, very affirming for us in this world, in the transplant world, to be able to see patients and see, oh yes, transplanted 10 years ago, 15 years ago, and so forth. It's a feel-good moment for the transplant surgeons, for sure. But what's interesting about that is I almost never recognize the patients. I recognize the families because the families haven't changed. But the patients, of course, have regained their health. Many of them have put weight back on, and they look like completely different people. And I always have that moment where I look into their eyes, and then I have to look at their name tag, and then I look back into their eyes, and then I look at their family, and then it clicks in my head, oh yeah, that's who that is, because I recognize the family member. And I think that's great. I mean, that's really the way it ought to be.